And so specifically, when we're thinking about making a diagnosis of ADHD, there's a couple things that we look at. So we always want to really look at specific symptoms. And so looking at symptoms of inattention, so things like getting distracted easily, having a hard time focusing, and then also symptoms of impulsivity and or hyperactivity. So part of making the diagnosis of ADHD is assessing whether or not a child presents with a specific number of those symptoms. And then beyond that, we want to make sure that the symptoms and those behaviors, that inattention, that hyperactivity, are causing problems for the child. Because as you know, as humans, we all have different levels of inattention at different points, or maybe might be more active in different periods of time. But part of having a diagnosis or a professional making a diagnosis of ADHD is showing how those symptoms present at a frequency that's higher than the kind of the typical range of individuals at that age or in that group, and showing that those symptoms cause impairment. And so impairment can really be anything from impairment in academics, impairment in parent-child relationships, impairment in social relationships, but just showing that those symptoms really cause problems for the child is an important part of the diagnosis. And then the other thing is that symptoms, if a child has a diagnosis or meets diagnostic criteria for ADHD, it means that those symptoms show up across environments. So it's not just that in school, a child is having trouble paying attention. It means that you might also see that at home, or you might also see that in swimming or in baseball or in other environments. And so those symptoms show up across environments. So really those are different kind of pieces of a diagnosis that we look for. We look for the symptoms in a certain frequency of symptoms being present. We look for those symptoms causing impairment, and we look for those symptoms being present across settings.